Welcome to the VET S.O.S podcast. Remember, don't drown in the sea of transition. Grab the VET S.O.S Lifeline. On this Memorial Day, we remember all our brothers and sisters who made the ultimate sacrifice for our country and way of life. We owe them our eternal gratitude, and we continue to pray for their families they left behind. Today, we're kicking off our full week of releases with the Wounded Warrior Project. Our guests today are Crystal Serrano-Hairston, who is going to be talking to us today about Wounded Warrior Project's mental health services, and Jennifer Land, who will be talking with us about triage services. Fresh off digging our foxhole to my height, I'm here with my brother in arms, Keith. How's it going today, brother?
It's going great, but for all of our listeners, if you haven't heard in previous episodes just how tall Sean is, digging a foxhole to his height means that took 3 days, 2 shifts, and a permit from the city. I'm actually pretty sure we hit a water table, but I'm doing great. How are you doing, Sean?
You're not tired?
I'm exhausted.
I am doing well and really excited to get into this. This time of year is always, so filled with emotion, right? One, it's the anniversary for the podcast. We started it right around Memorial Day. And then, of course, you have Memorial Day, which always brings up memories and, from our time in service and things like that. And, so just so much goes into this, some joy, some sadness, and, just continue to pray for the families, our veteran community. And, it's just great to be able to sit here and talk with an amazing organization like Wounded Warrior Project and, help get this information out. So I'm doing well, man. I am doing well. So, all right, let's jump into this.
Serious on me again. Like I was trying to bring levity into the moment, and you're like, "All right, fine, I'll be serious the rest of the episode."
No, nobody wants that. Nobody wants seriousness. So, all right. So we got Crystal, who is a veteran advocate with the Complex Case Coordination Program at Wounded Warrior Project, where she leads a team of liaisons dedicated to supporting veterans with complex behavioral health needs. Her work focuses on coordinating care across multiple systems and advocating for each warrior throughout their journey, partnering with the VA and private care facilities to ensure veterans receive timely and seamless support. Crystal comes from a proud military family. As a Navy brat, she was raised in a household shaped by service, with her father serving 20 years in the U.S. Navy. She also has 2 brothers who have served or are currently serving in the military. Jennifer currently manages the operations and partner relationships for Wounded Warrior Project, a network of mental health programs and services. Jennifer and her team provide oversight and support to Wounded Warrior Project's triage team, as well as to the check-in program. Check-in connects veterans and their families with the clinical and peer partners within the Veteran Wellness Alliance. Prior to joining Wounded Warrior Project in 2018 as a Warrior Case Network screening specialist, Jennifer was a mental health provider for community care agencies, managed care facilities, and private rehab centers. She has a passion for serving our nation's ill, injured, and wounded service members and has been an advocate for improved service delivery and connection to care standards for veterans and their families. How are you doing today, Crystal and Jennifer?
Good. Thank you.
Good.
I'm happy to be here.
Sun's out. It's a good day.
Absolutely. Yes. Well, we're excited to sit down with you today and really excited about this particular. I know I'm excited about this topic because my wife is a social worker. She's worked in skilled nursing facilities for years, and that she brings the passion to all of her clients that are there in the nursing homes. But she always has that special soft spot for the veterans, especially being a veteran spouse, and so I love this specific topic and can't wait to get into some of this. But let's first start. We'll go to you, Crystal. You come from a military family. Is that the driving force behind wanting to work with veterans, or are there other things that got you into working with the veteran community?
I would have to say probably I've been around it since day one. My dad joined boot camp when my mom was pregnant with me, had me, and was off to boot camp. So it's all I've known since forever. My brothers, like I said, also joined. One that's still in, hopefully transitioning out here soon. So I came from a police department before this, and my dad told me to look into Wounded Warrior Project, and I did, and I was like, maybe a good difference. As my husband's a police officer, so it was time for us to kind of separate that positions for us after having children. So, and I've been here going on my 13th year with Wounded Warrior Project, and it's been pretty amazing. Ebbs and flows, but great work that we do. I feel like if I would send my family here, which have been able to use some of these services, I would definitely recommend it to others.
That's awesome. That's great to hear. Jennifer, how about you? What led you to work with the veteran community?
Oh, goodness. Well, September 11th was a transformative time for all of us. And I was in college. And I think being married to a service member throughout that period, knowing a lot of the frequently deployed, special operations community and folks that really were in the very beginning of all of that, really shaped my impression of the needs, of what people need when they come back from service like that, and seeing the gaps in care, seeing the barriers to care, seeing how long it takes people to get into the care that they need really inspired me to want to make a difference. And I feel incredibly empowered and blessed by my employment at Wounded Warrior Project, because it feels like we're actually doing the work. We're actually, digging in and making an impact. And there's just never a boring day. There's always a problem to solve. There's always work that needs to be done, and there's always a veteran to help. So it's inspiring every day.
I don't know if you guys saw it, but Keith just shivered when you said digging in. He's fresh off digging that foxhole. So, uh, what do you think, Keith? You're muted if you're talking.
There's a country song about this.
Well, because you talk so long. But no, I'm just kidding, Sean. Those intros were huge. I just didn't want to make sure I had a dog barking in the background or something. No, like what both of these programs are doing is mind blowing to me. Really, I mean, it's serious, heavy stuff, right? And both of you talk so positively about it. And I'm just kind of curious, first for Crystal, like what you do, right? It's minute to minute, right? It's serious stuff in the moment. And I'm just curious, like when you're working and are leading a team of liaisons through a case and it's, in the moment kind of thing, like what does the coordination look like behind the scenes of what you do? And also how do you fight against burnout in a role like that?
Um, for us, when we get the case, I always tell teammates, I'm like, hey, those that are sending them to us, make sure that you let the warrior veteran know that we are coming in and we are full throttle. Like, if you say you want this assistance, this team is going to kind of come in and just start banging down whatever doors we can get them at any point in their transition, whether they've been trying to get help and have been stalled out by the VA, their own personal choices, or whatever it looks like. We're going to sit down, we're going to talk with them, we do an intake, and we start moving. We start reaching out to the VA. If they have private insurance, we start providing support and finding care and resources there. So it's not like we really just hit the ground running once that warrior says, yes, I want your assistance, and we go through and we get a little bit about them. So I'm very adamant about that. Let them know, because if we call the VA and the VA tells us no, we're going to call 3-4 other positions in the VA. If we call a provider and, it's the warrior that's been the hinder, we're going to reach out and we're going to talk to the warrior and kind of balance it out to make sure that they get the care. So it's what we consider barriers to care. So if it's them, or if it's whoever they've been reaching out to, we're going to come and just start moving immediately into seeing what the best. We don't provide any clinicals or anything like that. We don't determine the care that they need, or so we work as a team with them, their providers, to see and how we can help get them where they need to be.
Yeah,
And sorry, for
go
the
ahead.
burnout
Yeah.
side, that's really big for us, on just one, in this role with veterans anyway. Like, we have a lot of veterans that are on our team as well, but we have, all of them are just chatty Cathy's, of course, the humor can sometimes I just sit there and look at the chat and think, oh my God, like, guys, simmer down. So, we let them vent. We have, as for leaders, we have one-to-ones with them all the time, always readily available. Encourage, taking time off to decompress. We see all the cases that come through. So I make sure if there's one that's really high needs and a lot of trauma, making sure I'm checking on that teammate and making sure that they're taking the time that they need, because it can be a lot. It might be that warrior veterans trauma, but once you start sharing it, and it can get a little different for the teammate as well.
Let me ask a
Yeah.
follow-up there for that burnout question. Does that ever trigger one of your teammates, traumas that maybe they're still dealing with or coping? Have you had to deal with situations like that as a leader?
Not directly where they would admit to it. Like, it's knowing your people and watching. I'm a big observer. I'm not a big talker. I like to watch and observe people, and that's kind of how I get to learn my team when we're in chats and just letting them kind of tell me about themselves, and watching those. I'll never go deep into whatever anybody's personal, story is, but you got to watch and listen for those little nuggets. So if it's something like our team, they just want to go and start doing the job, and I'm going to be off today, but this person's calling. I'm like, nah, I can let somebody else, and they're like, no, and sometimes it's a battle, and I'm like, okay, fine, but I give you 30 minutes and then that's it, so because also that's for them and what helps them with it. So it's definitely a balancing act, and watching and making sure that, us as leaders are covering down for our team.
Absolutely.
Yeah, one of the biggest issues, or not issues, but challenges, working in this space is that, you can't take care of others if you're not taking care of yourself. So I feel like we may have jumped the gun a little bit and jumped into Chris's program, because I want to back up now and talk about the check-in program. So, Jennifer, fill our listeners in. Like, what is this check-in program? How does it work? Like, what is it all about?
So check-in is one half of the two lobes of our team. And I say that because we're all screeners, we're all assessors, we all have mental health backgrounds. And triage is the entry point for how individuals get connected with Wounded Warrior Project's mental health programs. But many times when we're conducting outreach, we go to community events, we're at VA events, we're meeting veterans from all walks of life. They might not necessarily be eligible for Wounded Warrior Project services, or they might just not want to engage with Wounded Warrior Project, and that's okay. The check-in program is a program that was founded by the George W. Bush Institute, Wounded Warrior Project, and Combined Arms. And it is a parallel path where we can quickly get folks connected to care. It's veterancheckin.org, and it's available for anyone. It's available for family support members. It's available regardless of character of discharge. And it's we would like to say it's agnostic. It's not driven by one particular brand. It's just a collection of folks, veteran service organizations that are highly valued in the space, that form the Veteran Wellness Alliance. And that's the network of support that's available to veterans and their families. One of the key hallmarks of the check-in program is that, if you want to check in on somebody else, if you know somebody needs care, we'll do the best we can to reach that person. And you can submit a form on their behalf and say, I'm worried about my son, I'm worried about my sister. And we'll do the best we can to surround them with resources, everything from peer support to clinical support. So we just like to say that our investment in check-in and our support of check-in expands the scope of how Wounded Warrior Project serves veterans and their families. It is an investment that was done very intentionally, and it just opens the scope of who we can serve. We like to say there's no wrong door. I know you've probably heard that, but we just think that we're all in this space together, and like I said in the beginning, there's enough work for all of us.
That's fantastic. I didn't know until we started doing a little research here about the check-in program. I'm curious, like, what, I don't know if you have numbers, but like what's could you give us like a rough estimate of like how often that actually is like successful? Because I'm imagining you reach out to somebody, you might get some pushback. You probably get pushback a lot from somebody. Hey, I don't want to talk to you. Why are you calling me? So I'm just curious,
Well,
like, what's the response rate like?
yeah. So we do. I mean, any mental health line to help is going to have a pretty high non-responsive rate. I mean, typically we see non-responsive rates 30-40%. I'm not sure if it's exactly the same for the complex care team, but just this is all referrals coming in for mental health, which is pretty normal. We know that we deal with individuals that are struggling with the disease of avoidance. PTSD is something that keeps people isolated. It keeps people avoiding the reach outs and the easy pathways to help. And we have to work around that. That's on us to be more agile and flexible to the needs of the veterans that we serve. So we have to get creative. And I got to tell you, a lot of what we do is planting seeds. If I give you resources and information, I don't know. I'm not sending a read receipt. I don't know if you looked into those resources. I don't know if you made that connection, but it's in your inbox. And I cannot tell you how many times we've had people pop up. Their case has been closed for a year or two, and they say, "Hey, man, I found your email, or I found your card in my pocket, or, I was watching the show, or I was talking to somebody on a plane, and it triggered." And they might not have been ready a year or two ago, but they're answering the phone and they're reaching out now. And that's a good news story. I mean, that is the best thing we could hope for. So we know that a lot of that work, even though we're not seeing the end result of it in the moment, we know that one day they're going to pop up again. That's the hope, is that they don't give up and that they try again later.
That's that's fantastic, and I'll admit that my interactions with Wounded Warrior, I think every time I've received some sort of attachment on the email. You guys give out a lot of information, which is fantastic. So, um, Keith, I don't know if you have a specific question, but I was gonna jump into asking about how it works. If I call you, and we can start with Crystal, and if we call your department, how does that whole process work? Like as someone on the other end of the phone.
Well, when you call in, you actually will get our resource center, who will then route you to Jennifer's amazing team, our triage team, to kind of go a little bit more in depth into the needs that you have. Because again, for complex case coordination, we're the advocates that will really push whatever the need is. If it's having issues with the VA. Some people that come through don't necessarily need that much of an intensive case management type assistance. So all of our calls go through the triage team to make sure that they are an ideal fit, and so that my team doesn't really scare them off when we come in intense and ready to go. But like Jennifer said, sometimes we do get some that are like, yes, I absolutely need this, and we don't hear from them. It's like that. And we try with our team to get as close as possible when we get that referral to call that warrior back, because that little time is when they're really willing and able to do the work. So
Absolutely.
we definitely try to do a quick turnaround to get them, and we'll keep calling, and depending on what the referral says and the need, we will hold it for a while before we close it out and push it to that closed out queue, so that it gives them that opportunity. I'm very big on, if not today, tomorrow, in 2-3 weeks. I came through the resource center when I first started at Wounded Warrior Project, and I used to have guys that would call and be like, my friend said you guys are a good organization and I just want to refer somebody else. And as they're kind of telling the story about this other friend, I'm like, is it your other friend or is it you? Let me help you. Like, let's talk about you. And then I tell them, you don't have to do anything today, but you're in the system, and when you need us, you've gotten the little part done of getting registered, and all you have to do is ask for the help. So that's kind of even with us. If we tell them what we do and they're like, maybe not, maybe I'm not that committed to this part of, getting myself, situated. We're like, okay, well, you have our number. You can always reach back out. It's not, you said no and you can never call back. We're here.
I, I, that should be the new slogan. We're here for you and your friend.
Yeah.
I like that because I can see that conversation
Oh, yeah.
happening. Absolutely. Okay, so Jennifer, let's jump back to you with the triage piece. How's that process work when I call in? Are there specific questions that help your team guide it to a certain direction? Like how's the process work?
So, kind of to Crystal's point, the resource center is our first line. That's who is answering and fielding all of the calls that come in, because a lot of times people want information about financial resources, or they want information about an event that they saw advertised in our email newsletter called The Post. And we don't, like Crystal said, we don't want to put them through all that if they're looking for like lower level needs that can be serviced through the resource center. If they are asking for mental health resources, then it creates a referral to our team. Typically, we say 3 to 5 days, but typically if a referral is put in on a Monday afternoon, they're getting a call on Tuesday morning. Our team has a pretty quick turnaround. And to Crystal's point, I just want to double down on this whole idea of this window of opportunity when it comes to motivation for change. Again, PTSD, disease of avoidance, isolation, creating barriers to why somebody else deserves it more than me, right? And when we get them on the phone, we do a brief mental health, kind of an interview or screening. I think of a mini biopsychosocial, something that you would typically do like when you're going through an intake for care. We don't want to get into somebody's trauma narrative. We don't need a lot of details about the circumstances, but we do want to know what they want to work on. And if they want to work on PTSD or issues surrounding TBI, or if they want to start outpatient therapy, really just depends on what they're looking for. A lot of times they don't know what they're looking for, and that's okay. We try to shepherd them into the program that's going to be what they're ready to engage in, but also what they're going to be eligible for, what's going to be the most appropriate level of care. A lot of times they have issues and things that they want to work on that are outside the scope of just one program. So, we have adventure-based mental health workshops, we have outpatient care, we have intensive outpatient care, accelerated treatment models at world-renowned academic medical centers, and everything from that level of care to weekly goal-oriented telephonic support through our TALK program. But if one of those internal programs or services can't meet their needs, then that's when we're going to ping Crystal and her team. We've got a lot of Teams chats. We do a lot of collaboration. You had mentioned behind the scenes before. The behind the scenes work with the inner teammate collaboration is huge, because we want to make sure that we're prepping the next person so that that veteran doesn't have to tell their story all over again from square one. We like to make sure that Crystal and her team knows what they're getting into, knows and have resources ready to help with that first phone call. And then after we get them connected to the program or the resource, we do follow up. We make sure that they're connected. We can track down services if they're having issues. We just really try to be more of a case manager, social work kind of model, so that that person knows they have an ally and they have a supporter that knows the system and that can make things happen. And I think that's empowering to most of the people that we work with.
Absolutely.
Don't want anybody to
It's
feel
already
alone.
about that time.
I know. That's what I was like. I don't even know how to wrap this up because it's flowing so well. I don't want it to end. And at this point, I mean, we're on episode 2, Memorial Day of a week-long series, and just the fact that we're having to bring on 2 guests for every show, and we're still not getting to everything I want to talk about, or we all want to talk about in the course of one episode, just goes to show that just the breadth that Wounded Warrior Project is covering and all that. I'm like, I want to ask a question: is there anything that y'all don't do? Because it doesn't seem like y'all are missing anything. But again, unfortunately, we are at time. But on the way out, I got 2 questions for each of you. One, how can folks get in touch with you? Maybe even not so much for the care. I mean, care, yes. How can they get? But even if they want to support your programs and help out or get involved, how can they get in touch with you? And then second, for each of you, fortune cookies aren't really fortunes anymore, right? You open and like they're just sayings and phrases, but if you could write a fortune cookie specifically for a veteran who's about to call into your program, what's something, what would that fortune cookie say to them? What would you encourage them with, or maybe make them laugh with in that fortune cookie? So who wants to go first? Crystal, go ahead.
To reach us, call the resource center. Monday through Friday, 9 to 9, 888-997-2586. You can reach somebody at any point in time. They also have chat if you go through our website. So resource center, please, and just chat. My fortune cookie, that's a good and a hard one all at the same time. I would say I'd go back to what I say. If not today, if not tomorrow, reach out when you're ready. If you just want to chat, Wounded Warrior Project is here. We get, somebody that calls nothing for nothing really. Just call. You never know what you're going to get at the end of the day, but we're here and available to you.
Okay, so
you,
Crystal
Jenna?
already plugged the resource center. Absolutely, double down on that. But also we have an app that has been really remarkable in getting folks connected to care, self-directed. So, you're scrolling at 2 a.m. and you're like, oh, that looks really interesting. MyWWP, it's available in the App Store. And that is a really good way to browse programs and services and get connected with other veterans at your leisure. And gosh, fortune cookie, it's like I want to talk about dark humor so bad, but I don't think anything I'm going to say is going to be appropriate for a recording. So I will say I guess my message, my hope to every veteran would be treat yourself the way you would treat a brother or sister that you served with. Talk to yourself the way you would talk to a brother or sister that you served with, because you're worth it and there's a lot of support out there. And I realize that none of that's going to fit on the fortune cookie, but that's my message.
I was going to say both people would have little scrolls on the fortune cookie, but no, that's great stuff.
It's a front back fortune cookie.
There, front back. There you go.
Microtext.
Well, then where do we get the lucky numbers from? Because that's in there. Anyway,
Keith, I don't know about you, but now I'm intrigued by this dark humor piece. We might have to bring Jennifer on for a whole other episode just to find out about this dark humor.
I kind of wish I heard it. All right, but we unfortunately we are at time, so we do have to wrap this up. I want to thank you both for coming on the show and sharing all that you do. We didn't even get to all that you do, and so thank you for all that you do. And on behalf of the entire VET S.O.S family, we want to thank everyone for spending their time with us on this Memorial Day. It's always great having everyone along for the ride. Don't forget to check out our other episodes and keep coming back for more stories, insight, and support from the VET S.O.S crew. If you enjoyed this episode, give us a follow, share the show, and tell a friend or two. Toss your battle buddies, fire team, shipmates, and wingmen that flotation device that they need in transition so no one drowns in the sea of transition. And as always, remember, grab the VET S.O.S Lifeline.